Welcome to Advanced Pain Care's Facebook Live. We're going to take a couple seconds to let people join us. Go ahead and start submitting your questions, and we'll get started.
Hi everybody, I'm Dr. Mark Malone with Advanced Pain Care. Sitting here with me is Chester Jones, our patient ambassador. Chester has a spinal stimulator and has really changed his life. I also have a spinal stimulator, and it changed my life. I want to tell you a little bit about that. This is Dr. Brad Culling, my partner here at Advanced Pain Care. Brilliant doctor and not a bad looking guy, I think, right? I just wanted to share some information and stories about the spinal stimulator. I was a pain doctor. I've been doing this for about 17 years. And then about 10 years ago, I injured my own back. I actually was just messing around with my wife and trying to pick her up over my head like I used to. And I felt a pop in my back and I fell to the ground. Nothing was ever the same after that. I was on the ground for hours, and then finally crawled into bed, and I knew there was no point in going to the emergency room because I've seen this happen. I was hoping it would be a temporary injury, but it turned out to be more or less permanent. I got a little better over a few weeks and went back to work. Was only able to work about half days, and this went on really for years. I saw all the pain doctors, physical therapy, spine surgeons. I had all the treatments, the injections, medications, chiropractic care. I finally ended up having 2 back surgeries, both of which failed. I ended up with even more pain, and it seemed like it would just go on forever. Finally, about 4 years ago, I noticed, and still working in pain clinics, that we were having much more success in spinal stimulation. The spinal stimulator is a small device like this. It's a little bit like a pacemaker. It's placed under the skin and wires are run to the spine, and it's programmed to interfere with pain signals that travel on the spinal cord. I was getting great results with my patients, and including Chester here. So I had one done on my own back, and it's like day and night. As soon as we turned this on in the recovery room, the pain was gone. That chronic pain that I had for years is just gone. I get a little emotional even talking about it. But I really want to share this with all of my patients and anyone that'll listen. This is really an amazing miracle that has come along, and we can actually cure chronic pain with this device. I'm happy to answer any questions, and of course, Brad and Chester are too. Are there any questions out there?
Yes, we have our first question. Who is a good candidate for spinal cord stimulation?
Well, there are a lot of candidates. One of the best candidates we see is what we call failed back surgery. That's when you have back surgery to try to treat your pain, and it doesn't relieve your pain. It often makes it even worse. That's what happened to me, and I believe that's what happened to you, right, Chester?
Yes, it is.
When did you have your back surgery?
The first back surgery was 2008, and that just didn't work for me. Then from there, they did a series of nerve burnings. They did injections with steroids, and I even had a radioactive treatment.
Yeah.
None of those things worked. I think the most relief I felt was about 2 weeks.
Oh, yeah.
And then the VA said I could come see you.
Yeah.
And then when I came to see you, I had the neurostimulator.
Yeah.
And that was just amazing.
Right.
That was amazing.
Absolutely. And that was about 4 years ago.
Yes.
Yeah, I remember.
Yes.
I remember the case. I think we did you right before we did me.
Correct.
Yeah, that's right.
Correct.
So you're one of the reasons I got mine done. Right. Dr. Culling, what do you think are some other good indications for the stimulator?
Well, I think there are a lot of really good candidates. Really anyone with chronic pain, whether it's chronic neck pain, chronic low back pain, especially people like you two who've had surgery, still continue to have a lot of pain.
Yeah.
Those are some of the ideal candidates. And then there's a lot of what I call sort of neuropathic pain syndromes, like complex regional pain syndrome, where someone may have an injury of their arm or their leg, and they have a lot of burning neuropathic pain from that.
Right. Nerve
Stimulator-
damage,
nerve
right? I just call it nerve damage because that we don't know exactly what it looks like. It's microscopic damage to nerves.
Right, right. And those patients are also great candidates. You know, they're oftentimes on really high dose pain medications, really difficult to treat, and we found that spinal cord stimulation for them too can be very helpful.
Right.
Yeah, that's something that worked for me as well, because remember my feet
Yes.
were tingling and burning really bad.
Yeah.
But after the stimulator, it went away.
So we got your feet and your back.
Correct.
That's awesome.
Yes.
That's a great success story. All right. Any other questions out there?
Our next question is, how long does the procedure take?
Dr. Culling?
Sure. So I usually like to tell my patients that, you know, it's a two-stage process. So the first stage is the trial period, where you basically take the system for a test drive, more or less.
Yeah.
Now, both the trial and the implant portion of the procedure, they're both outpatient procedures, meaning you go in, you have the procedure done, you leave the same day. The trial period takes about 10 minutes or so to put the actual electrodes in the back. And then the implant portion of it takes anywhere from about 45 minutes to an hour to do. Again, you go in, you have the procedure, and then you leave the same day. So they're you know, relatively minor surgical procedures. And in our hands, we do a very good job, and we get patients in and out rather quickly.
Right. So the first step is a trial or a test.
Yes.
Where
yeah.
you put in a temporary wire and you tape the battery to the back on the skin, right? And,
Yes.
and then they go home and test it out for about 5 or 6 days.
Correct.
And then they come back in and you pull that wire out. It doesn't hurt at all.
No, not at all.
And you talk about how much relief you got.
Exactly.
How much
Yeah.
relief are they getting after this test?
That's a good question. I would say the vast majority of patients usually get about 50% pain relief from the trial period.
Yeah.
And oftentimes it's even more than that, 75%, 80%.
Yeah.
Sometimes it's even 100% of their pain is gone with,
Yeah.
during the trial period.
Yeah.
And so we look at that when we kind of determine if someone is a good candidate to move on and get the implant done. We also like to look at to see if, you know, maybe they were able to get their opioid medication or their pain medication reduced during that time period too, because that's also, you know, a great indication that yes, this thing is very helpful
Yeah.
and very beneficial, and they in those patients too, we like them to move forward with the implant.
Right.
Also looking at their overall function,
Right.
and so we take all these things into
Yeah.
account
Yeah.
when we sit down with them and determine if yes, they would be a good candidate
Yeah.
to move forward for the
Yeah.
implant.
Chester, how much relief did you get with your test, your trial?
My test was about 75 to 80%.
Solid.
Yes.
Solid
yes,
numbers.
yes,
So you
solid
knew
numbers.
right away that you were going to get this implant.
Oh, definitely.
Yeah.
Definitely.
That was
yes.
me too. I'd say 95%. That chronic pain just was gone.
Yeah, and that's not uncommon. You know, we see,
Yeah.
you know, we tell patients that the trial period could be anywhere from 5 to 7 days.
Yeah.
Oftentimes people come back in 2 or 3 days. And they say, you know, my pain is so much better. Get these leads out. I want to move on to get the implant done.
Right.
And I feel like we see that all the time.
No question.
Yeah,
Right,
yeah.
right. All right. And then after your successful test, how much time do we wait before we do the permanent implant?
It's relatively quick. A lot of times it kind of determines, you know, with insurances, how quickly we can get people back in to get
Yeah.
the implant done. I usually tell patients at least a couple of weeks.
Yeah.
You know, that way we can submit it to their insurance company.
Yeah.
They can approve the procedure, we can get them back in
Yeah.
a timely manner and get it done for them. So it's a pretty quick
Yeah,
process.
yeah. And most insurance pays for it?
Yes, yeah,
Oh, that's
a good amount of insurances do pay for it. I would say the vast majority do.
Yeah.
Especially if they have some of the syndromes we mentioned earlier,
Yeah.
like the failed back syndrome or complex renal pain syndrome.
Yeah.
Those are some of the diagnoses they'll cover.
Awesome, awesome. Great to hear. Great to hear.
Yes.
Okay, we have another question. What are the risks and benefits of spinal cord stimulation?
Risk and benefits. The biggest risk I always tell people is that it doesn't always work. But I'd say it does work around 80 to 90% of the time. So that to me is the biggest risk. Other risks, if there's anytime you put a needle in somebody, there's always a risk of bleeding or remote risk of infection. Would you say, Brad? It's good.
Right.
It's kind of the standard
Yeah.
risk of any procedure.
Sure, absolutely, yeah. Yeah.
Anything else that we need
Yeah,
to
I
worry
mean,
about?
with the trial, you know, when I'm talking with patients, when I bring the spinal cord stimulation up, you know, with the trial at least, I tell them one of the biggest risks I tell them is that it may not work, like you mentioned.
Yeah.
In which case we can just kind of pull the leads out and try something else. So especially with the trial and our experience and the fact that we've done thousands of these cases, I feel like it's a very safe procedure, and we get patients through them very, very well.
Absolutely. Absolutely. Did you have any complications at all, Chester?
I didn't have any.
Good.
I didn't have any.
It worked first time, and it's just
Yes. Yes.
Absolutely. Good, good. Well, me too. I had no complications. You can imagine my partner who put it in was a little nervous working on the boss, but it went perfectly. Absolutely.
Our next question is, can you see the device through your skin, and can others tell that you have it?
You sort of can. You can sort of see mine. I don't know, should I show the camera? Okay. I often do this. People ask me. So this is where mine is. I don't know if you can see it. There's a little tiny scar there, and I can feel it. I'm kind of a skinny guy. Not as skinny as I used to be, but I can kind of feel it, but just barely. Most people never know that I have it. No one can see it from, casual looking at me. How about you, Chester? Can anyone tell that you have one?
No.
It's buried. It's easy.
Yeah, and these batteries are very small if this comes out well on the camera, but it's about the size of a pacemaker that you would see for someone's heart. So it's a fairly small battery, and you're able to put it underneath the skin about up to an inch.
Yeah.
And so most people really can't see it. Sometimes they can feel it.
Yeah.
But it's very oftentimes not uncomfortable, and patients do well with it.
I tell people it's the size of a double stuffed Oreo. What do you say about that size?
Yes.
Cookie size.
Yeah.
Okay, our next question is, how soon can I resume regular activity after the procedure?
Pretty quickly. After the trial, I recommend going back to regular activity the next day.
Right.
You can go to work, you can do the dishes, mow the lawn, whatever you normally do, we want you to do that again so that we can tell how well it's working. After the implant, what would you say, Dr. Culling?
I usually tell people about 2 weeks or so of light activity.
Yeah.
No real heavy bending,
Yeah.
lifting, twisting, things like that.
Yeah.
And then I let people know it's about 6 to 8 weeks for the full recovery.
Okay.
And that's when I typically will let them go back to their normal daily activities.
Right.
So it's relatively quick.
Yeah.
And if we can keep them from doing those things during that 1 to 2 month period,
Yeah.
I think that gives us a better chance to make sure that everything heals up.
Right. Chester, when did you go back to activities after your implant?
You actually made me wait until we did it on a Friday or Thursday. I came to see you Friday morning, and then I was on the road for a 14-hour ride, around about an hour afterwards.
Oh my Lord!
Yes.
So he took a
Yes.
day off, and then took a 14-hour road trip. Which before you got this implant, that would have been painful, right?
It would not have happened.
Yeah.
It would not have happened. I barely left the house.
Oh God, me too.
I wasn't going to the store
Yeah.
with my wife. I
Right.
really wasn't doing anything.
Yeah.
You know.
Before my stimulator, sitting in a car or sitting in an airplane was two of the most painful things I could do. In fact, my wife would drive me around in our Suburban with me lying down in the back. I'd go to doctor's appointments lying down on a sleeping bag. But right as I have my implant now, I can go on a long car ride. In fact, I drove my daughter to college, which she's in Boulder, and that's a 14-hour drive.
Our next question is spinal cord stimulation reversible?
Absolutely, it is reversible. Brad, do you want to speak to that?
Reversible, and can the device be removed reversible? Yeah. If it is rare, but it can happen, and there are circumstances to where patients would need to have the device removed or explanted.
Yeah.
And it's usually done in cases where maybe a patient didn't realize it at first, but now they need an MRI for whatever reason.
Yeah.
And in order to do that, maybe they have an older system and they're not able to get MRIs.
Right.
So sometimes they request that we get, they say, hey, my doc wants to get an MRI.
Yeah.
They're trying to work me up for
Right.
something.
Yeah.
In that case, we can remove the system, and it's relatively easy to take the system out.
Right.
While it is an implant, it's not permanent in that it can never come out.
Right.
We can take them out, and it's
Yeah.
easy. It takes maybe about 20 minutes to take out the system completely.
Right.
And again, that's a a minor surgical procedure like the implant portion
Yeah.
of it. So yes, it can come out, and there are circumstances where we do that.
Yeah. Unlike back surgery, which is not reversible, once you get back surgery, that's a permanent change to your spine. These are removable, just like a pacemaker. And like Dr. Culling said, some of the older systems were not MRI compatible, so occasionally we have to remove one, but it's not common.
Yeah. And I will say, if we do remove them, we can absolutely put it back in.
Yeah, yeah. Put in a newer system that is MRI compatible.
Right.
Awesome. Is spinal cord stimulation safe?
Absolutely. I think it's absolutely safe and effective. I'd say it's a lot safer than traditional back surgery. I'd say it's very safe. Would you, Doctor?
Yeah, very safe. I mean, the procedure itself, from the standpoint of how it's done, they oftentimes can be done with just some moderate sedation.
Yeah.
We don't necessarily have to put the patient completely asleep to do the procedure, much like they would if you're having a major back surgery.
Right.
So that in and of itself makes it a much more safe procedure.
Right. So no anesthesia complications.
Right.
Right.
And the way we put these procedures in, when we do put the leads in, we put them in the epidural space.
Yeah.
In order to do that, we have to do an epidural injection, and that's probably the most common, procedure that we do. And so in our hands, it's very, very safe. And again, we've done thousands of these procedures and very little complications.
Right. I agree. Yeah.
Awesome. Our next question is, I've lived with chronic pain for years. My spine surgeon told me I needed a fusion. Is this an alternative to that surgery?
Some people do need a fusion, and we would be the experts to ask about that. We have not only 10 double-boarded pain specialists on staff, but 3 board-certified neurosurgeons on staff. We are the perfect people to tell you if you really need a fusion. Now, in general, a fusion is medically necessary if you have significant weakness in your extremities. That is the easiest question to ask someone if you want to separate those who need a fusion from those who do not. If you do not have significant weakness in your arms or legs, there's a good chance you do not need a fusion. Would you agree with that, Dr. Culling?
Yeah, absolutely. And a lot of times I'll often refer to our neurosurgeons before I do, move forward with the spinal cord stimulator, just to make sure that they're not a surgical candidate
Right.
before we move on to the stimulation. And it's something with having neurosurgeons in-house, it's very easy for us to do and
Yeah.
refer it out and get that taken care of.
Absolutely. Great.
Our next question is for Chester. They're asking, when can I return to my usual activities?
Well, for me, it was just a quick and easy 3 days when Dr. Malone released me. Now, like Dr. Culling said, you might want to take it easy for a couple of weeks, but almost immediately, because the pain is gone.
Yeah.
That's great. Our next question is, can I actually control the spinal cord stimulation therapy?
Go ahead.
Yeah, sure. Yeah, yes, you definitely can. There's what one of the programmers looks like. So when you eventually if you end up moving forward and getting the implant done, you'll get this programmer that comes with the device. It's a little iPhone-looking device, and basically you can have several different programs on there depending on where your pain may be located, how intense it is. And so you can have, more or less kind of a mild, medium, strong therapy, and you can toggle back and forth through that. It makes it very, patient-friendly, patient-focused. And there's also ways to where you can feel the stimulation in your back, maybe not feel the stimulation. So there's a whole variety of things that you can program on here and really tailor it to your specific needs.
Great. Our next question is, can spinal cord stimulation help with pain in more than one part of my body?
Absolutely, it can. Chester's a great example. Chester
Yes.
had back pain and his feet were on fire, right?
Yes.
He had neuropathic pain. With one of these little devices, we were able to knock out pain in both the back and the feet.
Yes.
And so we see that quite a bit.
Yeah.
Now, sometimes, like if you have back pain and upper extremity pain or neck pain, we may need 2 devices. So one for the low back and one for the upper body.
Awesome. Our next question is, how often does the battery need to be replaced?
What do you think?
Well, I would say it depends. You know, there are 2 types of batteries. There's essentially a rechargeable battery and a non-rechargeable battery. And how long they last, it kind of depends on how much energy basically the patient is using through the battery. Now the rechargeable batteries will last much longer. I usually tell patients that they can last anywhere 5 to 6 years, sometimes longer. The non-rechargeable systems, they last a little less time, and I let them know it's anywhere from about 2 to 5 years.
Right.
And that's kind of just a ballpark number. It does depend again on how much energy they're using, what type of system they have.
Right.
But they can last for quite some time. And when it comes time to replace the battery, that's a very easy procedure to remove the old one and put a new one in.
Right. I agree.
Our next question is, will you still continue my care once the surgery is completed?
Absolutely, we will. We don't always need to, because many patients don't need pain medicine after the procedure is completed. And so we gradually can stop seeing them. Of course, we're always there if they need anything. But some patients still need some kind of medicine to supplement the stimulator. We're not in a big rush to get them off of medicine. If they still need medicine, we're absolutely okay with continuing their medical care. Often it's tapered down to a lower dose. But if you still need pain medicine, we're not kicking you out.
That's great. Our next question is, do I see a pain management doctor or neurosurgeon for spinal cord stimulation?
I'd recommend coming to see a pain management doctor. Look for board certified pain management specialists like all of us are at Advanced Pain Care. If we feel like there's a question about what therapy is needed, we will have you go across the hall to see our neurosurgeon.
Great. Another question is, if I'm not ready to do a procedure yet, what are some alternative treatments?
What do you think, Dr. Culling?
Well, you know, we have a huge array of treatments that we offer at Advanced Pain Care. You know, we manage pain, chronic pain, both with medications, and we do a lot of interventional therapies for that. And having board certified interventional pain management docs on staff at Advanced Pain Care, we do quite well with those procedures. Most commonly for low back and neck pain, we do a lot of epidural steroid injections. We can do various nerve blocks for neck and low back pain. We do a fair amount of what are called radiofrequency ablations, where we basically target the nerves going to the joints in the neck and the low back, because that's very commonly a trigger for chronic pain. And we're able to more or less burn that little nerve, and that can help kill the pain transmission going to the joints, whether it's in the neck or the back. And that works really well too.
Yeah.
And then, so yes, we have a lot of therapies to offer, and our patients do very, very well.
Right. Chester, you had some of these procedures before your stimulator, and they didn't actually work that well for you.
No,
right?
they didn't.
So that happens. I mean, you said you had a couple of weeks relief.
Yes.
But so sometimes they work very well, and that's all you'll need. You may get one injection that lasts you for years. But if you are not responding to these injections, we're really glad there's a stimulator that we can go on and trial.
Does this procedure help with both my neck and back pain?
Absolutely can. And sometimes one battery can cover both neck and back. Sometimes you need 2 batteries, one for the low back and one for the neck. I always tell patients, let's do whatever hurts the worst first.
Yes.
And most people do rank them 1 and 2. So if it's your back that hurts the worst, let's do that first. Sometimes just covering your back will improve the neck as well. But if you still need something for your neck, we can do a second battery for your neck.
Sure.
Great. Is it safe for elderly patients?
I'd say very safe.
Absolutely.
Yeah, I mean, it does depend some on if they have other medical issues going on. So if I have an elderly patient who I think is a good candidate for this, I like to work closely with their primary care docs, or maybe it's their cardiologist, whoever else they're seeing, and make sure it's all of their medical conditions have been optimized more or less before I can move forward with something like this.
Yeah.
And, you know, medications in the elderly can have a much more profound effect, especially pain medications.
Yeah.
And so using something like spinal cord stimulation oftentimes can help get them off of these medications, maybe decrease their risk of falling, breaking a hip or something like that. And so I think in that patient population in particular, it's very beneficial.
Yeah, I'd say it's safer than the alternative, which is is chronic pain medicine,
Right.
or possibly a more invasive surgical procedure.
Sure, absolutely.
So yeah, I'd see it's very high in the safety profile.
Another question from one of our viewers is, what's the difference between a primary care physician and a pain management specialist, and why does it matter for people with chronic pain?
Well, primary care are the doctors who take care of your primary medical needs, like you're managing your diabetes, your hypertension, helping to manage your weight, and the front line for managing any cardiac issues or pulmonary issues. Pain specialists, most pain doctors are trained and board certified in anesthesiology first, which is the science of putting people to sleep and waking them up and doing nerve blocks. With that basis, which is a 4-year residency program, they do another year, a fellowship of interventional pain management, where they specialize in the highly special techniques of blocking chronic pain generators, doing surgical implants, and other special procedures for management of chronic pain. Chronic pain is a disease state of its own, and it's unlike any other, but it can be approached from medication, nerve block, steroid injections, spinal stimulation, and even intrathecal drug pumps. So it's completely separate from primary care.
Thank you for that info. We want to thank our audience for all your questions. We will take about 5 minutes for more questions, so please keep submitting. Our next question is, what is the difference between a pain pump and a spinal cord stimulator?
Do you want to speak to that?
Sure. So a pain pump essentially is a device much like a spinal cord stimulator is, but what a pain pump is it delivers pain medication to the fluid around your spinal cord. And that also comes in a 2-part process, much like the stimulator, meaning that you come to our surgery center and we do a trial first where we put pain medication into that fluid and then we see how you do. If you feel like your overall pain is much improved with that, we can move on to do the implant, and that's where we implant a pump that has a reservoir that's full of that medication.
Yeah.
And then that medication is continuously delivered to the fluid around your nerves, and you get pain medication that way.
Yeah, and this would be like morphine, right?
Exactly.
You know, actually liquid morphine is delivered in tiny amounts directly into your spinal fluid, and it blocks the pain receptors, so that with a tiny microdose of morphine, you can block the pain receptors that are causing all this tremendous pain that you experience. And by doing it this way, you don't get the systemic side effects, right?
Yeah, absolutely.
Like the drowsiness, the itching, the allergic reactions, and the constipation. So it's a very advanced technique.
Sure.
It is highly effective.
Yeah, absolutely. Yeah.
Yeah.
It can work well, and again, like you mentioned, get people off of oral pain medications to help reduce some of those side effects they may be experiencing.
And because it's a little more involved than a spinal stimulator, we reserve it for people who fail the stimulator. So that 10% of people that don't benefit from this, there's always the morphine pump in reserve, and that device almost always works.
Sure, yeah, definitely.
Highly effective.
Another question we have from a viewer is, what levels of the spine are the leads placed?
You want to talk to that, Brad?
Sure. So I would say for that it depends, and what I mean by that is it depends on where your pain is located. So essentially all of the nerves that come off of your spinal cord, they go to various areas throughout your spinal cord. And so depending on where your pain is will depend on where those nerve fibers enter the spinal cord. And that kind of lets us know where we should put the electrodes.
Right.
And so typically if we're aiming for something like to cover someone's low back pain,
Yeah.
we'll put these electrodes in what's called the thoracic spine, which is basically the middle part of your back.
Yeah.
And we usually put them around your 7th thoracic vertebrae, which is, I tell people, is more or less right where your shoulder blade is located.
Right.
And so those leads will go on that spot, and that's where we found to really cover a lot of low back pain and leg pain too.
Yeah. Yeah. So, for example, if your back is hurting in the low back area, which is very common, and that's what I had and what Chester had, we count up, this is L5, 4, 3, 2, 1, and then T12, 11, 10, 9, 8, 7. This is where the sweet spot is on most people. We place the wires under the bone and next to the spine. And that's where the nerves that are covering pain in the low back are closest to the surface. So that's why the sweet spot is around the T7 or T8 area.
Yeah, absolutely. And if you have pain, say just in your leg or somewhere else lower down, we can put the leads kind of wherever we need to. And again, and then if you have neck pain or arm pain, we put the leads in a specific area, higher up in the neck area.
Yeah.
And when we do this procedure for both the trial and the implant, we're able to monitor intraoperatively.
Right.
And that really gives us the best idea of where these leads need to go, because we're able to map out in real time on the table
Yeah.
where the electrodes are covering, which parts of the body they're getting. And so that really lets us know where to put it.
Right, right. We have a system called neuromonitoring where when the patient is asleep, we can tell where the stimulation is going by looking at a screen. And so when we get the sweet spot, we know by looking at our screen that we're in the right place.
We have another question from one of our viewers. I see that advanced pain care has multiple specialties, including pain, neurosurgery, behavioral health, orthopedics, and rheumatology. How do you all work together to treat patients and prepare for this procedure?
So we do have multiple specialties, and they all have a piece of the pie when you talk about chronic pain. Like the interventional pain specialists are very well versed in the diagnosis and treatment of pain and medicine management. Neurosurgeons also are very focused on chronic pain, and they look at it from a surgical point of view. Like, is there a surgical cure or treatment for this particular type of pain? In other words, are there pinched nerves that need to be decompressed? Or do they need, for various medical reasons, do they need a surgical lead placed instead of the percutaneous leads, which basically is a lead placed through a needle? So also orthopedic surgeons focus on degenerative joint disease, which is very common in our population. Most people who have a degenerative spine also have degenerative hips and knees. And so we're easily able to take care of these people within our own clinic. Often they'll just walk right across the hall to see the other specialist.
That's great. Chester, what is your quality of life now?
My quality of life is tenfold better than what it was before. Like Dr. Malone and myself and Dr. Culling were talking, I used to be basically stuck in the house. Now, like we was talking about going to Lowe's,
Yeah.
I drag my wife now.
Yeah,
you
that's
know.
awesome. So you have a normal energy level, right?
Correct.
Yeah. When you have chronic pain, one of the things that hits you the hardest is your energy level, right?
Yes.
It drains your energy.
Yes.
So you're only able to really do things like work or be with your family for about 4 hours a day. That was me, and after
Yes.
that I was exhausted. But again, I have a normal life now, like you do.
Yes.
I go to work in the morning, I come home in the afternoon, and usually, if there's time, I take my boat out, because that's what I do to relax. I would have never been able to do that before I got my stimulator.
And that would be like me with my dune buggy now.
Yeah, you have a dune buggy,
Yes,
right?
yes.
And you ride that thing through the woods, and you
Yes.
jump creeks, and
Yes.
all that kind of stuff. You've
Yes.
never done that before.
No, there was
right?
no way.
It hurts too much.
I wouldn't even consider it.
Exactly. Was it, when you had your chronic pain, was it standing or sitting was the worst for you?
It was a compilation of both, actually.
Yeah.
I couldn't stand for more than maybe 5 minutes at a time,
Yeah.
and then for sitting 2-3 minutes, and then I have to shift.
Oh, man.
It was bad.
You had it bad.
Yes.
You had it bad. I had it bad too, maybe not as bad as you, but I couldn't sit for more than an hour at the most. And that really, when you're, in this modern world, most people sit at the computer for hours a day. I couldn't do that. I had to skip the computer completely, and I had to have people do it for me. I could stand a little better than I could sit, but I absolutely could not sit.
And for our last question, what happens if my battery stops working? Is there someone I can contact at all times?
Absolutely. We have a team of nurse navigators, we call them, and they are your angels that will take care of any problem that comes along. You have their cell number. You can call them day or night with any problem, and they will get you taken care of. If your battery just suddenly stops working, we'll see you first. If it's daytime, we'll see you right away. You come in right then, and we will diagnose the problem and make a plan. If the battery is dead, we will replace it within a few days. If it just needs to be reprogrammed, we'll reprogram it that same day.
Great. Thank you all for joining our first live story. Any questions not answered will be addressed in a blog and posted on our website. Thank you so much and have a beautiful day. Bye.
Bye. Thank you.
Thank you.
So good, guys.
Good job.
We had so many viewers. We had like hundreds of questions, and it was like going on.
There's a lot of.